Open the case and remove the patient circuit. Undo the retaining straps for the vaporizers. Take out the vaporizers and secure them to the support stands with the screws behind the support stands. Push the vaporizers together. Take out the reservoir block and fit to the vaporizer inlet. Connect the clear section of the valve, ensuring the correct direction of flow. Connect the self-inflating bag to the front of the clear valve section. Connect the expiratory side of the valve to the case. Connect the patient's circuit first to the outlet of the clear valve section and then fit the other limb to the expiratory valve. Test the circuit is complete with a test lung or 1 litre bag. The anaesthetic agent output is controlled by moving the levers on the front of the vaporizers. The DPA system is suitable for anaesthetizing adult or pediatric spontaneously breathing patients or with assisted manual ventilation. The gas flow in the circuit works by entraining air through the one-way valve at the back of the reservoir block. This is either controlled by the patient's own inspiratory effort when spontaneously breathing, or through controlled manual ventilation by the anaesthetist squeezing the self-inflating bag. The circuit provided is coaxial. The gas flow runs through one side of the tube to the patient and then back down the other side of the tube to the expiratory limb. This becomes clearer if we change the circuit for a standard 2-limb Y-piece. One side of the tube connects to the clear valve and the other side connects to the expiratory valve. Now we can see as the gas flows out down one side of the tube and back down the other side. PEEP or scavenging can be applied on the 30mm outlet of the expiratory valve if required. Supplementary oxygen can be added to the system through this tube, either from an oxygen concentrator or from an oxygen cylinder using the regulator flow meter supplied. If the level of oxygen supplementation is less than the patient's minute volume, the bag will empty. If the oxygen supplementation is increased, the bag will fill and the circuit will become continuous flow. The overpressure valve on the reservoir block avoids excessive pressure in the system. The vaporizer will function in either draw-over or continuous flow. A smaller self-inflating bag is provided for pediatric use, and an Air's Teepiece can also be fitted if required. In order to use a Teepiece, the supplementary oxygen must be at least 3 times the patient's minute volume. The patient circuit valve is a linked system with an inspiratory side and an expiratory side. The two sides are linked by the stabilizing tube to close the expiratory side during manual ventilation. The Isoflurane halothane vaporizer is calibrated for either of those agents. The scale runs from 0 to 5%. It is filled by unscrewing the cap and using the funnel supplied. The vaporizer can hold up to 150 ml of anaesthetic agent, and the level of agent should always be visible in the sight glass. If the Sevoflurane vaporizer is fitted with key fill, it is simply filled by pushing the bottle into the filler cap. The vaporizer can be emptied in the same way. The settings on the Sevoflurane vaporizer are 1 to 4% and a further setting for induction that will provide a nominal 8%. The vaporizer can hold up to 150 ml of anaesthetic agent, and the level of agent should always be visible in the sight glass. If both vaporizers are fitted, one should always be in the off position with the stop device fitted.